I've always wanted to learn more about cancer, so I decided to find out.
You have had some sort of cancer. What kind of cancer was it?
I had breast cancer 2 years ago. I'm a breast cancer survivor.
Oh, that's good. So when you first, what age were you just diagnosed? Oh, not age, but...
I was 58 years old when it was diagnosed.
Do you know the cause of it? Environmental, gene?
Not environmental, and I did a genetics test and it wasn't genetic. I don't know if it was just one of those mutations that happen and that's how it goes. Yeah.
Oh, I see. What stage were you at?
My lump, when it was detected, was so small that it was pre-stage 1.
Oh, so you got it earlier, so
Yeah.
it was easier to survive.
Yes.
Oh, I see. So, what kind of treatments did you have to go through to?
Well, as soon as we found out, my doctor and I found out that I had this lump in my breast, I had a lumpectomy done on November 11th. And following that, about 2 months later, I started 30 radiation treatments.
Oh, was it, did it cause any pain? Like, what were the symptoms
Of
that you had of the treatment?
You know, when you have radiation treatments, it's like having a very bad sunburn.
Oh.
And so my affected area, the skin would turn dark. And when you looked at my breasts, 2 of them, one was darker and one was much lighter. It was very obvious that I had radiation on one side.
Oh. How did this affect your lifestyle, like before and after?
You know, I tend to be pretty upbeat about what you can't control. And it was pretty easy to do these treatments. It was a half-hour treatment after school. And I went to the Cancer Center of Hawaii for 6 weeks, 5 days a week.
That's really good. So did your nutrition change after, because sometimes you have to change your nutrition and exercise too.
You know, I think that not only, it wasn't just a matter of having cancer that changed my lifestyle, it was just getting older. And you realize you can't eat all the things that you'd like to do, like to have when you're younger, and that exercise is important. And they stress walking a lot.
Yeah. Thank you.
Okay,
Lauren.
thank you.
Thank
nice
you.
To have
Nice
you. Thank you very much. Bye.
Bye.
The interview made me want to learn more about cancer, so I decided to focus on a certain type of throat cancer called laryngeal cancer. Here are some professionals who know exactly what they're talking about.
Laryngeal cancer is a disease where cancer cells form in the larynx. Larynx is a part of the throat and is in the base of the tongue and the trachea. Cancer tumor starts from one abnormal cell. Today I'll be talking about how to get laryngeal cancer. So laryngeal cancer can be genetic or environmental. The exact cause of the cancer is unknown, but tobacco products play a significant role. Regular or heavy consumption of alcohol, radiation exposure, poor diet, like McDonald's over here, and long-term exposure to certain chemicals, fumes, or pollutions will increase the risk of having laryngeal cancer. So there are 5 stages of the laryngeal cancer, starting from 0 to 4, 4 being the most severe case. In stage 0, the cancer cells are found in the lining of the larynx. The lining of the larynx may be all around this area. This whole area is called the larynx. This stage is also known as the carcinoma in situ. Stage 1 is when cancer has formed, and the tumor is in one part of the larynx, but the vocal cords are still able to move. So, the tumor may only have appeared in the subglottis. In stage 2, tumor has grown into other parts of the larynx. So, the tumor is in the subglottis and the supraglottis. In stage 3, tumor is throughout the larynx, but has not spread any further than the larynx itself. So it may be on all 3 parts of the larynx, but it hasn't gone to any other parts of the body. However, stage 4 is when the tumor has grown into the body tissues outside the larynx. And the cancer cells may spread through the trachea, which is the windpipe, the esophagus, which is this area, and the thyroid gland, which is this area.
There are 3 treatments for laryngeal cancer. Radiotherapy is a common treatment and is used when the cancer is not spread from the larynx. It uses high energy beams of radiation to kill the cancer cell. Second treatment is surgery. This is used to remove the tumor itself. Third treatment is chemotherapy and uses anti-cancer drugs to kill the cancer cells. Survival for laryngeal cancer is that 65% will live for at least 5 years. 57% will live for at least 10 years. People with laryngeal cancer stages 0 to 1, you have a survival rate of 80%. People with stage 4 laryngeal cancer will have a survival rate of 25%.
I forgot. Today I'll be talking about the symptoms for laryngeal cancer. So, when you have laryngeal cancer, before you have laryngeal cancer, the most common symptom is hoarse voice. So that sounds strange, right? Because many people have hoarse voice and they might not even have cancer. So it's easily ignored. But when your hoarse voice lasts 2 or 3 days, then you should go see a doctor. Other symptoms may occur, including a lump in the throat, pain when swallowing, or difficulty with